Right now, medicines are given like candy. Patients are seeing doctors for 5 minutes, and they're given a pill. It's my belief that many of the medications that doctors are giving to patients today are more harmful than helpful to those patients.
They want that pill that they hope will take care of their problem thoroughly and rapidly, and most of these medications will actually do that very well in the short term. In the short term, they really work. The problem is in the long term, they're mostly disastrous.
I've always been very close with my parents, even when I was a child. I love school. I like to be with my friends a lot. I feel very comforted just being around other people. When I was 11 years old, I moved from Nashville to Milwaukee, Wisconsin. We moved a lot for my parents' various jobs, which is very hard in terms of keeping like lifelong friends. I would oftentimes just like sit in my room and listen to music and just like honestly just kind of mope around. I started having a lot of anxiety about school, and I was so anxious I got these stomach aches where I didn't want to eat. I wouldn't eat breakfast because I had a stomach ache. I wouldn't eat much lunch because I had a stomach ache.
I noticed that she'd gotten kind of thin. I just kind of blurted out, you know, do you think you might be anorexic? She went and got on the scale and she said, you know, I think I've lost 20 pounds. And so I just totally freaked out and got an appointment the same day.
And then toward the end, the therapist asked me to come into the room. She said, I think what would really be best to kickstart this treatment is for her to get on antidepressants. Wait a second, we came here for the talk therapy, right? We didn't come here to kickstart it with medication. That's the whole point of going to a therapist, I thought.
Rebecca was prescribed Zoloft for the first medication. She said it didn't really make a difference. She didn't feel any better, but she also didn't really feel any worse at that time. So when we saw her doctor again, the doctor switched her to Prozac. Shortly after, I had a business trip. And I got a phone call from Rebecca, and she said, you know, I've been seeing this little girl. And I'm like, what do you mean you've been seeing a little girl? Yeah, like you know, she's not really there, but like I can see her, and I named her Alice.
Like I genuinely thought that there were people here in the room that weren't there, that people could also see, but they were very real for me.
She came into our bedroom late at night, and she was shaking. She said, you know, the hallucination touched me and asked me to come into the kitchen so I could hurt myself.
And they said, you know, enough of this. She needs help.
This is crazy. It's very clear to me after having studied the science that the way we use psychiatric drugs do vastly more harm than good.
I never really thought that the medication was a bad thing. I was like, yeah, if this is gonna make me feel better, awesome. Okay, if this other one's gonna make me feel better, awesome. Oh, if these 4 are gonna make me feel better, great, let's do it. I will try anything.
There was never any notion that the medication was causing these symptoms. It was more like the disease was developing.
The only warning she sort of gave, but she was very dismissive about it, was you might hear Mr. Green, that in some instances, people who are on antidepressants might have suicidal thoughts, but this really isn't something you should be overly concerned about.
She said kind of almost flippantly, like, oh, you might want to lock up your knives. So we went out and bought
We did.
a lockbox,
Yeah.
and put anything, you know, dangerous in there. And that's really when it kind of sunk in even more, like, wow, this is serious.
So I was hospitalized that first time when I was 13. But over the course of a year, I think I was hospitalized seven, 8 times.
You know, leaving her in a hospital, a psychiatric hospital, I mean, this is just, you know, this was not our life. This was not our daughter. We knew our daughter. We knew, I mean, you know, a few months before she had been sort of, you know, a little depressed, melancholy, but this was a far leap from that.
And once in the hospital there, they added an antipsychotic because she was now experiencing psychotic behaviors. In addition, they had to prescribe another medication to take care of the known side effects of the antipsychotic. We didn't really know what else to do when we were in the system. We wanted to trust the experts. So, you know, we went that route.
My mind was just filled with horrible thoughts, like about me and about how horrible I was and how much I hated myself. I mean, what is even the point of me being here anymore?
We go into this field because we want to help people, but it's very difficult to know where to turn for unbiased evidence on these issues. The pharmaceutical industry has tremendous influence over what doctors learn, how they learn it. So general lack of knowledge about the dangers of these drugs is one of the main reasons that doctors continue to prescribe, even when they're inadvertently causing their patients harm.
Right before she went on medication, she was just fine. She was a little depressed, but she was not having psychotic episodes. She was not having body tics. She was not hallucinating. Do you think that the medication is actually the cause of this? It was as if I was asking the most irrelevant question in the world. I never got a really response. It was just not worthy of their attention. The more that we were talking about, this is who Rebecca is. We know our daughter. We know this medication has turned her into someone else.
We said, you know, we don't think she should be on medication, and here's why. And we read off the list of symptoms.
He basically said, you know, I think this is a really bad decision, a huge mistake. It was a reminder of a year in which, by and large, whenever we went down this path of, is medication harmful, we got no support from the psychiatrists that we saw. None. If it's not medication, then you're not doing it right. But we stuck to our guns. And this sounds very dramatic, but I feel that decision saved our daughter's life.
I kept thinking when she was first telling us that she was feeling depressed that I wouldn't even have had the vocabulary to say that when I was her age. So that just tells you a little bit about how pervasive this has become in our society. I see children who are acting out or feeling distressed. They are like the canaries in the coal mine, you know, that are basically shouting out like there is something wrong, but, you know, we quiet them.
I got out of the hospital, they took me off medication. Within a few months, I was back to normal. Not normal, but my hallucinations were completely gone, and what was left was the issues to begin with, the anxiety and the eating disorder. And then we could move to focus on those, because those were the problems. College was something that I never thought that I would do during that year, and even afterwards I was like, there's no way I can go to college, I can't handle that. But here I am, handling it. And it's paradise for someone who loves school as much as I do, so I'm just kind of being a normal college student and having fun because that's what I can actually do now.